at this limb of the femur is right at the edge of the table. And then the other thing again too, this is great. Hold it in my book. Depends on the table. Okay. Some of these tables have a pretty sharp edge, and if you start pushing down here, it bites the quad. So I would recommend you get a towel of some sort like this. And the other thing he doesn't show in this, and this is where, sometimes he shows a belt, sometimes he doesn't show a belt, but this is where I think a belt would come in handy. But you pick this up, and then you see how the femur now is in a straight line rather than on an angle. So you want to get that femur on a straight line. And then this leg can just get out of the way a little bit, okay? And then you can, the way the old book used to show it, is you would step on the inside. This is before you push on the medial side or you push on the lateral side. You just step on the inside, you take the knee, and most people that have a knee extension contractor will not, or knee flexion contractor, excuse me, will not be able to go in a knee extension. So they usually are stuck like this. All right, so they're in their actual resting position for you already. And then you just come in here, and this hand just grabs the tibia, okay? And this hand just goes on the proximal tibia, right in the middle. You can turn your body a little bit to get your piccolo traction. Your treatment plane is like this, and you just push along the treatment plane straight down. Now see how his butt's pistoning up like that? Okay? Are you able to walk, Adam? Yeah. We'll ambulate up here, please. Okay? Let's see. I don't see scoliosis. Come on around. Come around this side. I want you to put your hand right there. And again, Adam wouldn't be standing here normally. I'd have him over here, but so you guys can see. So you could use a belt, or you can have someone's hand there like this. You come in on this side like this, and then you notice how he doesn't move at all now. Okay, his body might be moving like this a little bit. But this is a good mobilization to get extension. Now, one of the things you're thinking about is this bone is going like this. It's not going like that. All right? So I'm not pushing and pushing at the same time. They're going together. So equal amount. Got it? Now, thank you. You look fine. Thanks. No, not like that. No. You're fine like you're fine. Like you look fine.
Thanks.
Okay. Now, one of the things I can simply do is I can take my hand and move it over to the lateral side a little bit more. Correct? You see what I'm talking about? And then I can take his leg, tibia, and maybe internally rotate his tibia slightly. And I can push on the lateral side. Okay? But with extension, which way does the tibia normally go? External rotation. So in reality, again, I think what you're going to see more times than not, if you're going to use this one, you're going to want to be pushing on the medial side, again, to facilitate what? That external rotation. So let's just do this. Slide to your left, and then get this leg off the table. Again, this is not, the book shows it this way. Yep, you're good. Like that. Slide up just a little bit more. There you go. Good. So, I can take this foot and do what? External rotate the tibia, coming on this side more medially, and then work towards extension. The other thing about this one that's nice is the patient can perform an active extension with it while you do the mob. So go easy there, okay? Extend your knee. Extend your knee. And do you see how I'm extending and externally rotating it? Works out pretty good, okay? So, you got that? It's pretty easy. One of the things you're going to see done in the clinic a lot, which I don't recommend, you're going to see people laying on the table and they're going to put a weight down here and they're just going to hang it. So do you see why that might be a bad idea for the tibial-femoral joint? Tibial-femoral joint. Because it does what? It does that. If you're going to put a weight down here, I would put a weight here too. So that it's what? A force closer to the joint, maybe coupled with this, and then maybe this weight, instead of being at the ankle, you put them here and here. Okay? Or you just put a weight here. But I'm not a big advocate of putting the weight down here, personally. I don't know what anyone else thinks.
I agree. There's a device called an extensionator. You all seen it?
is basically the person sits
Okay.
upright and there's a strap that goes across their thigh. So they're actually, and then there's the foot set on the ledge, and you're pushing down on the femur posteriorly,
Yeah.
which is basically the same thing as